can't breathe properly, even when your nose looks completely normal. What if the real cause isn't a cold, not allergies, but something silently growing inside your nose right now? Imagine driving through a narrow road filled with unexpected barriers. You press the accelerator, but your progress slows. You can't move freely. You feel stuck. That's exactly how your breathing feels when something inside your nose begins to block the airflow, quietly, gradually, and often without warning. This hidden issue is more common than most people think. Inside your nasal passages, soft, painless growths can begin to form. They don't announce themselves with sharp pain. They don't cause immediate panic. Instead, they grow slowly, like shadows expanding in a dark room. These are nasal polyps. Non-cancerous, but far from harmless when ignored. At first, the symptoms are subtle. A slightly blocked nose. A faint reduction in your sense of smell. Maybe you start breathing through your mouth more often, especially at night. You blame the weather, dust, maybe even stress. But over time, things change. Breathing becomes effort, not instinct. Sleep feels restless. You wake up tired. Food loses its aroma. Life's small pleasures begin to fade, so quietly that you may not even notice at first. Now picture this. A man in his late 30s. Active, healthy, no major issues. But he starts noticing he can't smell his morning coffee anymore. Weeks pass. Then months. His nose always feels blocked, but there's no mucus, no cold. Just resistance. Eventually, even simple breathing feels like trying to inhale through a straw. This is how nasal polyps often begin. They tend to appear in both nostrils and are more common in adults, especially as they age. And while they're not painful, their impact builds slowly, affecting your daily life in ways that feel frustrating, confusing, and exhausting. But why do they form in the first place? The answer lies deeper, in inflammation. Your nasal lining is sensitive. When it becomes chronically inflamed, it reacts. Over time, that reaction can lead to the formation of these soft growths. It's like your body trying to protect itself, but accidentally creating a new problem. People with breathing-related conditions are especially at risk. Asthma, chronic sinus infections, allergies, even certain sensitivities to common medications can trigger this internal chain reaction. And here's the unsettling part. Many people live with nasal polyps for years without realizing what's really happening inside their own body. Because the symptoms don't scream, they whisper. But what happens next will change everything. Part 2. By the time most people realize something is truly wrong, the problem has already grown. Those small, soft growths? They don't always stay small. As nasal polyps expand, they begin to block entire pathways inside your nose and sinuses. Air struggles to pass through. Pressure builds. And suddenly, what felt like a minor annoyance becomes a daily burden. You might notice frequent sinus infections that don't fully go away. A constant feeling of heaviness in your face. Headaches that seem to come from nowhere. Even your voice may start to sound different, more nasal, more restricted. And then comes one of the most overlooked impacts, your sense of smell. Losing your ability to smell isn't just about missing pleasant scents. It affects taste, appetite, even memory. Smell is deeply connected to emotion and experience. When it fades, something inside your daily life feels incomplete. Now imagine this scenario. A woman in her 40s begins avoiding social gatherings because she feels constantly congested. She sleeps poorly, feels drained during the day. She tries over-the-counter solutions, but nothing lasts. What she doesn't realize is that her body has been fighting silent inflammation for years, and nasal polyps are the result. So how do doctors uncover this hidden condition? It's not guesswork. A medical professional can look inside your nasal passages using a thin, flexible camera. In some cases, imaging scans or allergy testing may be needed to understand the full picture. It's a precise process, because treating the symptom without understanding the cause often leads to frustration. And treatment? Think back to that blocked road. Medication can reduce the inflammation, shrinking those internal obstacles and allowing air to flow more freely again. In more advanced cases, a minor surgical procedure can remove the growths entirely, clearing the path in a way that feels almost instant. But here's the twist most people don't expect. Even after removal, they can come back. Because unless the underlying inflammation is controlled, the cycle can repeat itself. That's why long-term management is just as important as short-term relief. This isn't just about breathing. It's about quality of life. About waking up refreshed, enjoying food again, feeling energy return to your body. It's about reclaiming something as simple and essential as a clear breath. If you've been struggling with constant nasal blockage, reduced smell, or unexplained breathing issues, don't ignore it. Your body could be sending you a quiet but important signal. Listen to it. Because the earlier you act, the easier it becomes to restore what you've been missing. Most people never hear the next part, and that's the real danger. Ignoring the signs until they take control of your life. Outro befitted style. Your breath is your life. And when something silently interferes with it, the impact goes deeper than you think. If this video helped you understand what might really be going on inside your body, make sure to like this video, share it with someone who might need it, and subscribe to Befittest for more powerful, life-changing health insights. Stay aware, stay informed, and most importantly, keep breathing freely.